Hello, my name is Jennifer Velasquez, and I'm going to be talking today about fetal mortality in the United States. Fetal mortality is a big problem in the United States. That means that the causes of fetal mortality and the ways in which to prevent fetal mortality should be better known in the United States. I will now share with you some of the common terms that are associated with fetal mortality. All of the following definitions come from the Center for Disease Control and their report on infant and fetal mortality. Fetal death. A death that occurs prior to the delivery of a product of human conception, regardless of duration of the pregnancy. This does not include an induced termination of the pregnancy. So, for example, if a baby is aborted, it is not counted in fetal mortality. The fetal mortality rate is the number of fetal deaths per 1,000 live births and fetal deaths. The number of previous pregnancies is a number devised by adding the number of previous live births and the number of previous pregnancies. More focus has always been on infant deaths as there is not much information on fetal death. In the United States, about 1 million fetal deaths occur during any of the gestational periods. Fetal deaths are usually counted at about 20 weeks of gestation or more. Around 26,000 fetal deaths were reported at 20 weeks of gestation or more in 2005. In 2006, there was almost an equal number between the number of fetal deaths as there were infant deaths. So even though there isn't as much information on fetal deaths, the numbers are almost identical. The U.S. fetal mortality rate went down from 7.49 out of every 1,000 births in the 1990s to 6.23 in 2003. This is a decline of about 17%. But after 2003, there has not been a decrease in fetal mortality. The plateau in the fetal mortality rate from 2003 onward mimics the trend in infant mortality as well. The Healthy People's Target Goal for the U.S. fetal mortality rate is 4.1, which is a huge leap from the 6.23 that is currently at. Fetal mortality rates differ based on the racial and ethnic makeup of the pregnant woman. The following information comes from the CDC's report on infant and fetal mortality. In 2005, the fetal mortality rate for non-Hispanic white women was 4.79, second lowest in the nation. The rate for Asian women was the lowest at around 4.78 out of every 1,000 births. The rate for Black women was the highest at 11.13. This has often been attributed to the fact that they have a higher rate of preterm labor, but there may be other factors at play, such as socioeconomic status and access to labor. American Indian or Alaskan Native women were at 6.17 out of every 1,000 births, and Hispanic women were at 5.44 out of every 1,000 births. Fetal mortality rates are much higher for twin, triplet, and higher order pregnancies than for pregnancies with only a single fetus. For example, the mortality rate for twins is at 16.8 out of every 1,000 births. The mortality rate for triplets or higher order pregnancies was 27.18. This is an increase of 9%. The high rate may come from increased rates of preterm labor, fetal growth restriction, maternal hypertension, placental and cord problems that can be increased as the number of fetuses grow. Many multiple pregnancies are also usually done so with reproductive technologies help, and that may contribute to the higher risk. Fetal mortality rates were lowest for pregnant women between 25 and 29 years old. Their rates were at 5.47. The highest risk was for those 45 years and over at 15.51. Being aged 35 and older was an independent risk factor for fetal mortality along with other medical conditions. The second highest was for those pregnant women 15 years and younger at 12.20. They may have such a high fetal mortality rate because they usually are of a lower socioeconomic status, and another factor could be biological immaturity. The amount of previous pregnancies can also have a direct effect on the risk of fetal mortality. The lowest fetal mortality rates were for women with one prior pregnancy, coming in at 4.87 out of every 1,000 live births. After 2 prior pregnancies, the chance of fetal mortality went up 18%. After 3, the risk went up 47%, followed by an increase of 134% after 4 prior pregnancies. So why isn't there more of a spotlight on the issue of fetal mortality? In the past, much of the public's attention was focused more on infant mortality. As a result, not many people are aware of the magnitude of fetal mortality and are unaware on how to prevent it. This is a huge problem because the rates are relatively high compared to more developed nations in the United States. The most common cause is premature birth, usually before 37 completed weeks of pregnancy. It takes up about 25% of the fetal deaths. The women most at risk for premature birth include women with a previous preterm delivery, women pregnant with multiples, as discussed earlier, and women with uterine or cervical problems. The health of the mother also comes into play. For example, she may have high blood pressure, she may have placental problems, or she may smoke. Intraventricular hemorrhage is also a problem leading to fetal death. Intraventricular hemorrhage deals with bleeding in the brain that may result in brain damage or death. Necrotizing enterocolitis is an intestinal problem that causes an inflammation of the bowel and can cause severe bowel damage. Infections because of the immature immune systems are also common. Asphyxia occurs when the fetus does not receive enough oxygen to survive. Oftentimes in this situation, the best way to prevent the death of a fetus and even an infant is to be involved and educated about the risk. Regular trips to the doctor to get yourself checked out can be helpful in finding the problem early, and it is hopefully still treatable. As a result of not many people in the United States being aware of the fetus mortality problem, many mothers are unaware of the fetus mortality problem, and they are unaware of the things that could happen to their fetus. People need to be better educated on all of these points in order to decrease the fetus mortality rates in the United States.